In cardiac sonography, we perform an ultrasound of the heart. So we're looking at the size and function of the heart. We're assessing the size of the chambers. We're looking at the contractility of the heart muscle, and we're assessing the valves of the heart, seeing how well the valves are opening and closing, and assessing the blood flowing within the heart.
So cardiac sonographers specialize in only the heart, and I love doing one organ. I love being really good at one thing. The heart is an extremely complicated organ. It has a lot, it's moving, we're assessing structure and function, and I like knowing and being confident that I know that organ really well.
So cardiac sonographers work in acute care settings. So they work in British Columbia, they work in hospital settings, which makes it very interesting because we have many different types of patients that we see. We see outpatients, we see inpatients, emergency patients, so it keeps the job very, very exciting. So you have to be able to think on your feet when you're scanning. If you see something abnormal, you need to explore that. You need to figure out why that's abnormal. You need to be able to really hone in on that pathology and acquire as many images as possible and assess the area very, very thoroughly. I think it's also very important to be empathetic because we see a lot of very, very sad cases in the hospital. We need to understand where these patients are coming from. I also think that it's very important to be friendly because we spend a lot of time with our patients. We're in close contact with our patients. Sometimes the test takes upwards of an hour. So we want to make sure that our patients are as comfortable as possible during that time.
I think the best cardiac sonographer is somebody who cares. You really need to care about the patient and really give them your full attention and full effort to do a good job. The most challenging part of a job in echocardiography is the day's not always predictable. You're going to have emergencies coming in. You're going to be told to stop what you're doing and go to the ER. So you have to be flexible and you have to be willing to change your routine. It can also be challenging when you have patients who have hard windows and you can't find the heart, and you have to think outside the box a little bit and go off the kind of axis and go to different spots and use creativity to answer the clinical question.
Working as a cardiac sonographer is challenging in the sense of you have a limited type of case that you do. You're really only looking at hearts with every case. So you tend to be in the same position a lot. So you're at risk for repetitive strain injury. So you really have to be aware of your ergonomics and just looking after your body when you're a cardiac sonographer.
So in cardiac sonography, dexterity and 3D spatial awareness are extremely important skills to possess. We have very, very small and very tight rib spaces that we need to use to see the heart with ultrasound. So the movements that we make in cardiac ultrasound are very small. We need to make sure that we know exactly where to position the probe and where to angle the probe when we're scanning so that we know exactly where the specific areas that we need to assess are.
A cardiac sonographer does transthoracic echocardiograms, which is the probe right on the skin. That's about 90% of our scans. We also do transesophageal echoes. We help the doctor in those. That's where the probe goes down your throat and we see the heart from inside the body. And we also do stress echoes, and this is where we have a patient on a bicycle and they're exercising. We get them up to their max heart rate, and then we scan and look at how their heart's working when it's beating really fast.
So in order to be successful in the cardiac ultrasound program, dedication to your studies is really at the top of my list, so a very strong work ethic. I think it's also very, very important to be open to feedback. We have extremely supportive faculty on campus that will guide you in the labs and facilitate your learning in the theory courses, so being open to feedback will really ensure your success in the program. Cardiac sonographers work as part of a team, so we work alongside cardiac surgeons, sometimes interventionalists. We work very closely with cardiologists in the department and often radiologists as well who are reading echoes. We work as a team of sonographers, as a team of cardiac sonographers in some departments. We also work alongside general sonographers in some situations. We work closely with the clerks in the department who check the patients in, and very, very closely with the supervisor and the manager of the department.
I think the hardest part's probably just from a physical standpoint, being able to maintain a static position sometimes, dealing with patients who are maybe compromised in that they're maybe hooked up to a respirator and they're immobile, or they can't perform, say, a respiration, or they can't help you with your exam. So you have to be very adaptable and be able to move around, work around that.